Hi viewers, I am Dr. KV Dinesh Reddy, Consultant Surgical Gastroenterologist, KIMS Sunshine Hospital, Secunderabad. Today I am going to discuss about gastritis. So what is gastritis? So gastritis is an inflammation of the gastric mucosa due to high acid exposure. So why this inflammation occurs? Like irritants to the gastric mucosa, drugs and stress or anxiety related, and few autoimmune conditions are there. Alcoholic, smoking and pan chewing, and dietary habits like eating spicy and masala food, fast food, junk food, citrus containing foods, and indigestion and eating of the unhealthy food, eating large quantities of the food, sleeping immediately after intake of the food can leads to the gastritis. And other causes like drugs like aspirin, painkillers like NSAIDs, and there are infections like Helicobacter pylori infection, and few autoimmune conditions also can leads to the gastritis. What are the signs and symptoms of the gastritis? Pain in upper abdomen or burning sensation in the chest, which is associated with nausea or vomiting, and bloating, belchings or burpings, and hiccups, and indigestion, and fullness after intake of the small quantities of the food, sometimes bad breath. Few patients will pass black colored stools, and sometimes blood in the vomiting also can occur with gastritis. So how to evaluate this gastritis? Apart from the clinical history, we usually do upper GI endoscopy. So after the confirmation of the diagnosis, we will advise the patient modify his lifestyle and dietary habits like avoiding alcohol, smoking and pan chewing, and advise regular eating pattern, avoiding of the spicy and masala food, excessive intake of the oil, citrus containing foods, and we advise to take small meals in frequent times. We will advise patient to not to sleep immediately after intake of the food. And apart from this, we will advise patients to do regular exercises, and if patient is obese, we will advise patient to decrease weight also. We will advise few medications that decrease the acid production in the stomach like proton pump inhibitors and antacids that to protect the stomach mucosa from the acid, and few antibiotics to combat Helicobacter pylori infection. Thank you.